So, what's the difference between a medical student, a medical resident, and an attending physician? We're going to talk about this today, guys, because I literally just had a patient recently ask me when I came in. I'd never seen this patient before. And when I came into the room, she said, okay, now wait, what type of doctor are you? How long have you been in practice? And are you going to be here for a while? And I completely understood why she was asking that question. She wanted to know if I was a doctor. And first of all, she wanted to make sure I was a doctor because medical students are not. She wanted to make sure that if I was a doctor in training or an attending physician, because a doctor in training usually is in a place for sort of a temporary period of time. And if I was an attending physician, she wanted to know how long I've been in practice. I give her lots of credit for asking all those questions. I'm going to explain to you what the difference is. First of all, since you guys are joining me, I'm going to humor you with a picture of me when I was a medical student. This is me as a baby doc, as we call them. This picture was taken literally, I would probably say around 2003 or maybe 2003 or 2004. I was a third year medical student. And one of the first clues to telling whether whoever you're seeing in the office is a med student or a resident doctor or a doctor, and again, I'm going to explain all those, is the length of the coat. My mother always says, oh, they're a short coat. She calls them short coats versus long coats. Medical students have short coats. So you can see here, when I was a baby doctor, this is me proudly standing up against a wall like a what are these called? Like a mugshot, like I was taken into the prison system, but taking a picture with my short coat. Okay, now compare that to what we call basically long coats. And for example, the coat that I have on now, I don't know if you can see that, you can't see the whole thing, but you can see that it's a long coat. It certainly goes pretty long. Here's an example. This is a picture I have. Actually, yeah, I'll show you this one. Now, this is not in a medical setting, but you see here, I'm trying to get the light out of the way. You see here how this coat is long. It's much longer than the coat that I had when I was a medical student. These are some professional photos I took a few years ago. Let me show you another one. You see that again. This is long coats, okay? So that's the first thing you should know, is that medical students have short coats, attending physicians and residents have long coats. But let's go a little bit more into depth, all right? Let's go back to the medical student. So when I was a medical student, way back, basically a medical student is someone who has already graduated from college. They've obtained their college degree and they're now in medical school. They're learning how to be a doctor. Now, generally, when you see them at this stage right here, which is kind of where I was showing you, when you see students at this stage, they're usually in their third or fourth year of medical school because they're on rotations. You're seeing them in the clinical environment, which means you're seeing them in the office. Oftentimes, they're trailing behind the big doctors or the more senior doctors. Medical students are not doctors. They are students. We don't have privileges to prescribe medications. We cannot give medical advice because literally we are just learning things. We are not licensed. We are not physicians because we have not graduated yet from medical school. This is medical students. But medical students learn on the job, okay? Medical students are supervised by resident doctors. Sorry about that light. It's just following me everywhere. They're supervised by resident doctors and attending physicians. So medical students are sort of at the bottom of the totem pole in terms of they're told what to do and they're completely 100% supervised. Because again, as a medical student, you're not even a doctor. You're still taking exams, etc. Now, once you graduate from medical school, oh, by the way, I'll see if I can find, oh, here's a graduation picture. Since we're talking about graduating from med school, I don't know if I've actually ever shown you guys these. Oh, by the way, here's another picture of me as a doctor, as a young med student. You see that short coat? I know it's a little blurry. So that's me with some scrubs on. I think I was on a surgical rotation, but that's a short coat. Short coats means medical student. So then, as you're a medical student, medical school is generally about 4 years, okay? In order to pass on, and I'm just going to pull up a picture of my graduation from med school. This is a lot of fun, right? In order to graduate from medical school, you have to pass a number of exams. Super important to do that. Here we go. This was taken from one of my parents' albums. So you can see I was graduating here from med school. This is, I think, in 2005 or so that I am graduating. That is me, okay? So you're taking a number of exams. You get to the point where you graduate from med school. This is my graduation. And once you graduate from medical school, you are then called doctor because you have earned that doctorate degree. However, you can't practice medicine yet until you get more training. The first year after medical school is generally called your internship year. When you are an intern, it means it's your first year of residency. You are a baby doctor. It is your first year as a doctor. And in fact, this is my ID from my internship year at Delaware County Memorial Hospital. I was an intern at Crozier, Delaware County. This is my photo. I remember like getting up super early and fixing my hair, and this was me as a baby doctor. Your internship year and your residency years are years when you are basically a doctor because you've graduated from medical school, but you are not practicing unsupervised. You are practicing under the guise of doctors who are fully licensed and fully credentialed. If you watch any shows like Grey's Anatomy, if you watch Scrubs or any of those shows, many of these shows have residents, interns, which is the first year of residency, and then residency, which are the years afterwards, where these are doctors, but they are doctors in training. So they are supervised everything that they do. You work in hospitals, you work in clinics as a resident. You do make a salary, but your salary is way much lower than you will get as an attending physician, okay? You are working many hours, 80 hours a week, more than that sometimes, okay? You are working many hours. Once again, you're in residency to gain additional training, all right? First year of residency is that first year after graduation from med school. You are an intern, and then you graduate to residency. Okay, let me see if I can pull up a picture of, here we go. I've got two pictures of residency. This is one hospital ID when I was at Our Lady of Lourdes. This is when I was a resident. So you see here, it says resident, okay? And then I actually have another one. This is when big hair was in. See that one? This is me also. I was a second year resident at this one. My mom actually literally saves all of my IDs, and she also has saved like all of my white coats from over the years. She's got them like piled up at home. So that's why I have a lot of these pictures. Let me see here. Oh, and then, okay. Oh, and good. I have another picture for you. Okay. So residency. You're making some money, not a lot. You're working a ton of hours. You do not have full autonomy. You do eventually get your license throughout residency. Okay, but you are still not independently practicing, okay? You are practicing under the guise of attending physicians, all right? And remember, when you're a resident doctor, you're a long coat, okay? Because you're a doctor. Remember, med students are short coats. Now, all right, this was one of my first years as an attending. Actually, when I was a young doctor, gosh, is this blurry? Maybe this was taken, I don't know. Well, so it was Jefferson. So that means this was probably taken, I had longer bangs at this time. I got to grow my bangs out longer. But this was probably taken maybe even 10 years ago, actually, when I was a brand new doctor. I've been in practice now for 13 going on 14 years. But you see here, it says attending. Oh, wait, actually, it's here. Let me turn the camera around. Hold on so you can see. I should have done that first so you guys can see. Okay. So you see how it says attending? So the attending word right there basically means that I am an attending physician. That means I am a senior physician. And I am basically, I'm board certified because I have taken my board exams. You can also be board eligible, meaning you haven't taken your boards yet, but you're eligible to do that. And by the way, you want to see doctors that are board certified, okay? You want to see doctors that have passed their boards. It basically ensures that your doctor that you're seeing has reached sort of a national threshold in terms of knowledge that would be expected for that specialty, okay? So whether you're seeing a plastic surgeon, a dermatologist, a cardiologist, whatever, you want to make sure they're board certified. But I was a young doctor, attending physician. I was, as an attending physician, you're still wearing your long coat, okay? You got the long coat on because you're a doctor. You are making a doctor's salary because you are no longer a doctor in training at that point. And you also supervise others. You supervise the resident physicians. You supervise the interns, which is the first year out of med school. You supervise the medical students, which, by the way, I do that now because I work at a teaching institution. Now, if you see a doctor who does not work at a place that's affiliated with a university, you may never see doctors in training or med students, okay? You may go to a private practice and never see young people who are training. But if you come to see me at my office or many other university offices, you will see med students running around with their short coats. You will see residents running around with their long coats, but they'll be running around because they're busy. And then you'll also see attending doctors. It's kind of crazy looking back at these pictures like this. It blows my mind literally that this picture was taken. I mean, gosh, this picture was taken like 2003. This is now going on almost 20 years ago that this picture was taken. And it just blows my mind. It's just crazy to think about how far I guess I've come and just what's happened in time. You always dream about things, but I really feel blessed that, I was able to reach my dream of becoming a physician. So this is the thing. One of the reasons why, and that's just sort of a brief overview. I haven't given you all the nuts and bolts. I haven't given you all the details about the differences between a med student, an intern, a resident doctor, and then an attending doctor. I haven't given you all the details, but that's the nuts and bolts. Remember, med students have the short coats. Short coat, okay, because you're a student. You're not a doctor yet. You can't really do anything but watch and help out, okay? You graduate from med school. You become a doctor. You go into residency, which is extra training in your field. Internship is that first year of residency, and then you do the residency. You're wearing a long coat because you're a doctor. You're getting paid, but just a little bit, and you're working lots and lots of hours, and everything you do is overseen by an attending doctor. And then when you pass all of your exams and you graduate from residency, you then become an attending doctor. That's a big doctor, still white coat, long coat because you're a doctor, but you get the big salary or the bigger salary. You also have the opportunity to take your boards, which doctors should be doing, and I'm board certified. Your doctor should be board certified, in my opinion, as well. That's sort of the hierarchy. Now, last thing I'll say about this, guys, which is really important, why my patient asked me that. And the purpose for you to understand is that when you go to see a doctor, you may want to ask too, is this a teaching institution? Do you have residents? Do you have med students? Do you have because it matters less for the med students because they'll come and go, and remember, they're not treating you. They will come in and ask you questions, and they will practice listening to your heart and lungs because that's how they learn. And by the way, you always have the right to say, I'd rather not see a med student, although we appreciate when you guys do, let me tell you, because that's how they learn. But when it comes to residents, residents are usually in training only for anywhere from 3 to 7 years, sometimes longer, depending on the specialty. I'm a family physician, so I did a residency for 3 years, internship 1 year, residency 2 years, okay? If I were going to be, say, like an endocrinologist or a cardiologist, my residency might be 4 or 5 years or something like that. I've lost track of, if I wanted to be, let's say, a neurosurgeon or something like that, I might be in training for 9 years, 7, 9, even 11 years, depending on what I was doing. It's a long time, okay? So how long you spend in training is determined by what you actually do. Now, back to my point is, one of the reasons why, if you're at a teaching institute, you may want to know who your doctor is because if they are a resident, they probably will not be there forever because they are training, okay? And they will then move on. Now, one of you have asked, and you have a great question. You're asking, what is a fellow doctor? You guys are so smart. So fellowship comes after residency, but before being attending. So fellowship is not something everyone does. Let's say you wanted to do what we call sort of a subspecialty. You didn't want to do just, I'm trying to think of something. You didn't want to do just internal medicine, but you wanted to go on to do pulmonary critical care or endocrinology or what have you. You would then become a fellow in that specific discipline after you've done your residency. So fellowship is a more specialized training that some choose to do as they go up the ladder and become more and more and more specialized. That happens after residency. Not everyone does that. I'm a family doctor. I did not do a fellowship. So I went to med school, I did my first year of residency, which is internship, my second 2 years of residency, and I graduated as a family doctor. If I had chosen to specialize in something like women's health or headache or something like that, I would have done a fellowship beyond that, but I did not. I'm a general family practitioner, okay? So that's the difference. Fellowship, they make more money than residents. They are long coats as well because they're doctors. They are more senior than residents, but they are not as senior as attendings. So there's a definite hierarchy with medicine. Medical student, intern, resident, fellow, attending, with fellow being the one that's optional, not everybody does. Does that make sense? And as you go up, your coat gets longer. Well, actually, as a resident and fellow and attending, your coat's the same length, which is a long length. Your salary does get a little bit bigger, and you have more responsibility. Okay, so I hope that's helpful. So you know who you're seeing when you see people in the hospital. If you see a short coat, you can pretty much be guaranteed that they are a medical student. If you see a long coat, they could be a resident, a fellow, or an attending. But at least you know where they are. So let me know who you see as a doctor. Is your doctor a resident? And by the way, residents provide excellent care. They are always overseen by another doctor. So do not assume that the care is inferior, because that's not the case. Remember, in fact, if nothing else, you get more eyeballs on you. You get more people looking at you, because it's not just the attending, it's the resident and or the fellow too. So let me know who you see. If you see a family doctor or an internist, if you see a resident, if you've seen medical students when they've come into the office, how you feel about it. One of you is asking where PAs go. So PAs are in an entirely different track because they are not medical doctors. So the track that I discussed is simply medical doctors, from medical school, internship, residency, fellowship, and attending physician. This is one specific track. PAs, nurses, and other healthcare professionals have their own tracks, but they are not medical physicians, okay? So that's the big difference. So I hope this is helpful. You guys are amazing. Thank you guys for the stars. I so appreciate you. For those of you on Facebook, if you've not liked and followed my page, please do. Let me know what you think about this video. Consider joining my subscription groups, Dr. Jen Superstars. For those of you who are on YouTube, hello. Make sure you subscribe to my channel and click the little bell for updates. Let me know if this was helpful. Guys, I'm Dr. Jen. You all are amazing. I love y'all. And let me know what you think. Okay, talk to you soon.